There's been several examples across the university of projects that have existed that show the potential for how UC Forward could work across the university in a more comprehensive way. So one example, for instance, is connecting CCM performance with design with the medical school and a doctor who's an alum of the university in creating a new performance video that actually demonstrates how the heart works. That's a great example of how very different parts of the university came together and actually created a performance, and then the video of the performance is actually the product. And the design program in fashion created the material that the performers danced with. So it had choreography, it had filmmaking, it had editing, it had film production design with medical science as the primary driver for the content of the event. So that's something few universities can do. Another example would be the patient gown that was produced from the Livewell Collaborative, where students from biomedical engineering, nursing, design, and fashion industrial design, and business students worked to develop a new gown that would reduce the incidence of infections for patients in the hospital, that would create greater patient dignity, that would allow patients to feel better about the clothing they're wearing in a hospital, also would be able to have full access for medical staff, and would also be cost effective so that it could compete with existing gowns. Well, healthcare is one of the great examples of a recognized area of interconnected complexity that makes solving problems far more difficult than previously. So the patients today are much more empowered with their knowledge of medicine. The understanding and the opportunities for therapies response to particular illnesses are far greater, and constantly newly emerging techniques and medication are evolving that doctors and nurses have to stay on top of. And the complexity of running a hospital to keep it both safe and effective and cost effective is extremely daunting. So the more comprehensive approach you can take to solving that, the better you're going to be able to see all the issues and resolve them in harmony, rather than solve three and find a fourth one you didn't address that actually compromises the first three issues. So in healthcare, for instance, nurses are wonderful people on the front end of healthcare. They very rarely get to have input on the products and environments that they work with. And what we found is they have great ideas and very often have to build their own solutions ad hoc to situations they come across. But if you take those and combine them with engineers and designers who can take those very early nascent ideas that are kind of just crudely constructed by a nurse to solve a problem and see its generality, you can take those insights and create solutions that can affect service and therapy in the way that nurses can't do themselves. So the nurses see the issue, they create a first level response, that becomes the kind of point of departure for other disciplines to work with them to see the potential of that becoming a broader solution for all opportunities like that. And so we're seeing that for nursing, we're seeing it with surgery, we're seeing it with understanding procedures of how people are admitted into a hospital. Information management is a huge challenge. So there's a whole area called bioinformatics, just managing health research data that's being generated by, by the thousands of gigabytes a day. How do you make that accessible? How do you organize it and structure it so you can go back and find it? How do you make it possible to not have to sign 15 of the same forms to get into a hospital? Things like that that are making hospitals more difficult to run and manage. These are the kind of issues that need multiple disciplines to resolve. Another area, not only in healthcare and professional settings, but the tremendous new growth area of the emergence of home care medicine in the home, where patients of every age are being much more responsible for their home care because stays in the hospital are getting shorter. Not only is this affecting young children and people throughout the age span, but also the concept of aging in place means that many people want to stay in their own homes for their entire life, and both transforming their homes to be more livable to accommodate different levels of ability, as well as being able to create medication capability, therapy capability in the home is growing as much as hospital care. And that's affecting every dimension of healthcare throughout the lifespan. And that, again, has traditional services that where home decorating now is affecting healthcare, what your furniture is like, what your lighting is like, how different rooms are set up to better accommodate different kinds of challenges. All of that is taking what traditional home decoration is and transforming it to a whole new level. And P&G over the last decade has been one of the leaders in understanding interdisciplinary teamwork and consumer-based research, and they're one of the companies that we've worked with to better understand how this model can operate, and the shared knowledge that we have between the university and P&G is one of the bases that's helping to drive the UC Forward initiative.